Elizabeth, actually, Elizabeth is the wife of a friend of mine, and this is her tooth. Probably it doesn't look that bad, but look, this is small silver filling. After it's removed, probably nothing left from the tooth. And this is another her filling here. And look, after the filling removed, which is a small filling by size, I mean, it's not bad, but look at this fracture here on the tooth. This is after we cleaned everything. I mean, not very much from the tooth remained. And I mean, nobody wants to wait until it hurts or until it breaks. So we replaced that with the porcelain restoration. And so again, when we checked her X-ray, I mean, doesn't show much, just a minimum problem. And most people, I mean, think that silver fillings are forever. They are not actually. They are not very good. And the people wait until a problem happen and then they start to fix their teeth, which will be very late. Most teeth, when they are under silver filling, they are subject to a lot of pressure from biting forces itself, and also pressure from the silver fillings itself, because silver filling can expand and contract and to create a lot of fracture. And you can see here, you can see a fracture line here, you can see decay here, even though the filling doesn't look that big, but it's all leaking. And a lot of decay also on the side of the tooth or between the teeth, if you will. So here it's showing you the fracture. You cannot see it a lot here, but after we take the silver off, you see there is a big fracture in the tooth. And when there is a fracture on the tooth, patients always feel pain on biting, feel pain when they eat, sensitive to cold, sensitive to hot, and nothing. I mean, they cannot see it. Here, after we remove all the decay, look, we still have a fracture here. There is a fracture here on the bottom of the tooth, and we had to do a root canal actually on this tooth because the infection already spread to the nerve, and not a lot of people like having root canals. This is the second tooth we fixed also, and it's with the same small filling, doesn't seem a problem, no big deal. We removed that, and you look, this is black area also, which is the decay area. Also, after we remove it, look how much left from the tooth, and you can see also the fracture here. There will be another fracture on the other side, and there is a fracture here. So that's what kind of damage silver filling do. They do quite damage. And I didn't do a silver filling in 10 years actually. Not a lot of dentists are doing it, but there is still dentists do that, and it's probably mostly because it's just like insurance driven thing, because this is a cheap thing to do. And you can get it for cheap, but you will pay for it, a lot after a few years. So that's how we fix silver fillings after we see there is a problems with them, and most of them or all of them will definitely have problems. We don't do them. We don't believe in them. If for a reason they are not good to the tooth, they damage the teeth. Actually, they break the teeth. Also, the other thing about them, they are ugly. Nobody likes them. They are black. So nobody won't have full mouth of metal when they smile. This is not the best thing. Not to mention other health problems that are linked to mercury and silver, but this is not the subject for this talk now. Just we try to illustrate the damage that can happen when big silver fillings in the mouth